manage and change these types of behaviors. As an employer and a health plan administrator, I am convinced that as employers, we have only begun to scratch the surface when making contributions to the health and welfare of our employees. Employer-sponsored healthcare coverage is certainly a first step. However, employer-sponsored health promotion activities must be used to augment health care benefits. Employees that have been engaging in unhealthy lifestyles must be redirected to prevention and wellness activities. Having access to classes and workshops such as smoking cessation, nutrition and weight management, and stress management can have a profound impact on health in the workplace. Did you know that for every dollar spent on smoking cessation for pregnant women, $6 in neonatal costs are saved? This type of information in the workplace is not only convenient, it demonstrates to employees that they are cared for and worth investing in. Two critical messages that result in high employee morale. Most importantly, I believe that employers should take an active, perhaps even a lead role in the development of a community health needs assessment. Because employers have so much at stake when it comes to competing in their industry, and because they are dependent upon a healthcare environment that meets the particular needs of the community from which their employees come, it would behoove them to encourage identification of top health-related issues. Once identified and prioritized, long-term community-based solutions can be developed to ensure that scarce resources are being placed in the most needed areas. I have provided a recommended reading list, of which most importantly, I would encourage each participant to acquire a copy of Charting the Course 2, the 1998 San Diego County Health Needs Assessment. It can serve as a valuable model for carrying out a like activity in your community. Thank you for your interest, attention, and participation.
Thank you, Kathlyn. Let us begin now the first question and answer session. We will try to answer as many questions as possible. Therefore, we ask that only one question be asked per phone call, and that these questions be as brief as possible. You may call the studio directly at the phone numbers or fax which now appear on your screen. We remind you to make your phone calls at a distance from the monitor to avoid feedback. And if we may have the first question, please. Okay, our first call is coming from Servicios de Información del Transportes in La Habana, Cuba.
First part of the video conference has been very interesting. My question is, how do you think the new information technologies and communication technologies can actually help communities to identify and to take care of the health problems that they have?
Technologies in health. I think it's an excellent question. Thank you very much. And I'm going to shift over to Dr. Lippin on this one and kind of balance that technology and health issue.
Okay, well, thank you. Thank you for the question. And hello, Cuba. I believe that we can most effectively deal with health issues to the extent that we can measure the problems. And the capacity to understand our problems through technology, through advanced technology, through computers, through employees and patients all over the world interacting with the healthcare industry through computer technology will provide enormous capabilities of understanding the issues and then allow us to effectively address those issues. So I think it's a very good question.
Let's come back to Kathlyn on this one as well from the health plan perspective. How has technology impacted the deliverance of health in medicine, if you will?
Sure. I agree with Dr. Lippin. One of the things that we need to do is to empower patients, our employees, with information about their health status. technology today, information that's available on the internet, allow these patients to become active participants in their treatment plans, in early diagnosis of their disease state, etc. Where previously we were essentially almost victims, and I use that word lightly, of course, because what we did was we were told, this is what's wrong with you, and you don't have the ability to get your hands on information from a layperson's perspective. I believe that organizations such as employer groups, governments, libraries, etc., to give access to the internet and information about disease can certainly help our employees understanding more about the situations that they're faced with or the situations that their families are faced with.
Very good. The empowerment of the individual, something that both of you talked about, or will talk about in your reviews. Our second question comes to us from Medellin and the Federación Nacional, and we'd like the question, please.
Buenos días.
Morning.
Good morning.
My question is the following. We know that the people who get sick what gets sick is not the body but the being, which somaticizes the problems. And so what should the company do at this point, the enterprise, the organization, when you know that it's the being, the spirit, the soul that gets it first?
We're going to go to Dr. Lippin on this question because it's something that he's actually been spending a little bit of time on. Yeah. The whole being, the holistic issue that you'll speak of.
Yes, thank you for the question. It's a very important question. Throughout my entire career, I've believed in a biopsychosocial model of healthcare. And I think your question is absolutely on target in regard to the responsibility that both the individual and the corporations have in understanding that model and really providing resources so that the entire human being, from a biological perspective, a psychological perspective, social, and even spiritual perspective, can thrive. Individuals have responsibilities, but certainly the workplaces have responsibilities in terms of the institutions throughout workplaces in the world.
Great. Thanks for that input, and I know you're going to expand on that a little bit in your talk. And now let's shift to our third question, which comes to us from the Serviço Nacional de Aprendizagem from Porto Alegre, Brazil. And perhaps we can expand a little bit more on these issues.
Buenos días. Our question is the following. How can we fight the abuse of alcohol, cigarette, and drugs when most of the media announcements and advertisements are giving value to the people who actually use alcohol, drugs, and tobacco?
Right, and that's something that we are fighting and facing here in the U.S. So, Kathlyn, maybe you can approach the issue of advertising and health from the community perspective, where you're very involved.
Yes. This is a concern of many in the healthcare industry, whether you are a provider of care or you provide access to care, as do the HMOs in the United States. One of the concerns that we have and share is that our message has to be louder and stronger and more frequent than the messages that are received every day from the young people in our community. As you mentioned, we have a big battle ahead of us. The statistics are showing that in the United States, that for the first time in 20 years, more adolescents are beginning to smoke cigarettes than had occurred in some time. That's very frightening, and I think a lot of that has to do with the way that it is portrayed in the media. And my response is that we have to come out with more frequent messages. We've got to de-glamorize the use of substances, alcohol, drugs, tobacco, and that message must continue to be placed everywhere we can get a hold of these people, in the schools, in the libraries, in our public health settings, etc.
Let's briefly, Dr. Lippin, shift over to the clinical side and what you're seeing actually perhaps happen in your company.
Yes, I completely agree with Kathlyn. I've definitely noted that there's been some improvements in the United States, at least, in terms of deglamorizing the issues. And again, corporations must step up to the plate and take responsibility for this includes the media, of course, the responsibility that the media must take, Hollywood, even corporations, of course, whose profits come from the sale of tobacco, alcohol, or prescribed medications. And they really must be good corporate citizens and be part of a very responsible effort to deglamorize the abuses of these very harmful materials.
Yes, and as we move into our next question, we're seeing some legal actions that have taken place in the U.S. that are forcing those in tobacco and alcohol to help participate in that education and training of most specifically some of our youth.
Absolutely.
So let's move to our next question, which comes to us from the Tecnológica in Nezahualcóyotl, Mexico.
Good morning. I want to know
Saber.
how is the relation between pollution and human stress? Thank you.
Thank you very much for that question. The relationship between pollution, the environmental aspect, and stress, this specifically is something that Dr. Lippin is involved in, so let's take first your views of that question.
Yes, thank you for the question. I am employed by a multinational chemical company, as you heard during the introduction. I'm very interested in your question. I definitely believe that pollution has an impact directly, a possible impact on the human brain. And it also has an impact through the perception of, even from an aesthetic perspective. So when an individual like yourself or myself notices dirty air or dirty water, from the standpoint of its impact on our aesthetic sense, there is a resultant impact on stress. So I think that there are biological impacts on the brain which we need to better understand. We call this the application of environmental medicine to neuroscience, and I think that that we need to do a better job with providing a more aesthetically, not only a cleaner world with cleaner air, water, and soil, but we need to provide a more aesthetic environment so that when individuals wake up in the morning and enjoy the outdoors, part of their stress relief is to not perceive a dirty environment.
The whole complex of where we come from, the community, the compression of work and life and home, it's all one now, so that view would be great. Thank you very much for that question. That was an excellent one. Our next call and question comes from the Universidad de Alicante, San Vicente in Spain. And the question, please.
Buenas tardes.
My name is Pedro, and I'm from the University of Alicante, Spain. I am interested in knowing, faced with the new increased strikes and labor strikes and unrests, etc., and now that we are also seeing that the companies and the organizations no longer cover their employees very much, who should then look after the community's health?
It's an interesting juxtaposition of issues, and I'm going to throw this to Kathlyn because she's so involved in the community here in San Diego, but perhaps you could address the gentleman's concerns.
Thank you. Yes, and it's an excellent question and one that we are grappling with, as you heard during my presentation. I believe that the responsibility of health care is a community responsibility, and that while employers are looking at the level of contribution that they are willing to make to provide health insurance benefits to their employees, that's only one avenue towards good public health care. I think that employees themselves, you have to have a self-responsibility in terms of your health care interest and health status. The government to some extent, churches, schools, they all play a part in health care. If we look at health care, you can look at it from a variety of perspectives. The first and most important from my perspective is prevention. And every one of these entities can assist and aid their community citizens in understanding what living healthy lifestyles, what vaccinations, what and interests in early interventions, the impact that it has on them in their community. So I believe it's not just the employer's responsibility. I believe that it is the entire community's responsibility to not only offer those services, but to find ways of funding them.
And if we may, thank you, Kathlyn, for that response, but if we may, Dr. Lippin, you mentioned to me earlier that much of what you're doing now is expanding in the public health arena or model out to the community. Can you briefly talk about how that would relate to what Kathlyn shared with us?
Yes, my field, which was previously known as occupational medicine, dealt fundamentally with worker health. But about 5 years ago, at least in my country, my specialty decided to expand its scope, and it became involved in environmental medicine. So we now call ourselves occupational and environmental medicine, and that brings us directly into impacting the public health as well as worker health. I completely agree with Kathlyn in regard to the broader responsibilities for health. You know, we used to hear that we shouldn't trust war to the generals only, and we shouldn't trust medicine to the doctors only. Each one of us as individuals and each one of us as leaders in various sectors, including the corporate sector, the community leaders, the religious leaders, need to play a role in overall health in the broadest sense of the word. Our First Lady says it takes a village, and I would like to borrow that phrase in terms of the total impact of all leaders from various sectors on improving the health of our communities.
I think that's a great interplay between the issue, and it was a great question. Thank you very much. Our next call and question comes from the Universidad La Salle in Pachuca, Hidalgo, and we look forward to your question. You know, we can continue that exploration of the relationship between community health and the work life. I think that's an excellent approach. Okay, we're going to move to a question from the Universidad de Occidente in Los Michos, Sinaloa. And we look forward to your question, please.
What activities are happening at the university levels in order to prevent use of alcohol, cigarette, tobacco, and other causes that are negatively impacting the health?
Academic, scholastic endeavors that maybe you're involved in, Kathlyn. Anything on your front?
Clearly, the health plans work closely with universities in the United States in training new physicians to identify during the initial health assessments with their patients behaviors that may lead to negative health status. I believe that it is very important that physicians spend more time with their patients, and right now in the era of managed care in the United States, many physicians believe that the time is limited, but it is critical for physicians to assess their patients' lifestyles to determine whether or not they are wearing safety belts when they are in the car, whether they're educating their children about safety belts, whether they are smoking in the household. From my presentation, I think I pointed out that smokers tend to come from households where smoking took place. Alcohol abusers tend to come from households where alcohol took place. So again, physicians, I believe, need to identify and be trained early that these are the kinds of lifestyles they want to identify, and then begin to try to change.
Dr. Lippin, what's happening on your front? You're involved with NIOSH, the National Institute of Occupational Safety and Health. What's the relationship there to perhaps the academic world?
NIOSH is the U.S. government's research arm of occupational medicine, or worker health, and I am involved with NIOSH. And I would say, in answer to the question, that NIOSH and other leaders in occupational medicine are very concerned with the stresses that university students are under these days. And when we think about university populations, they really are a subset of worker populations. And as a preventive medicine specialist, I completely am oriented to the notion that the earlier we can intervene with educational methods to promote health and prevent problems, the better. So we need to bring these messages into elementary education, and we need to really take care of our university students in regard to health. We need to do a better job. We need to enlist the leadership of the universities to take a much harder look at the health of their students, because this, to use a cliche, represents the future leadership of this country and yours.
Excellent points by both. Thank you. It was another great question. Our next question comes to us from the Centro de Gestión in Santo Domingo. We look forward to your question as well, please.
Buenos días.
What criteria and strategies should an organization take into account, particularly in the Caribbean and Latin American regions, where there is no social security program, and most of the employees, the workers, are rather very poor, and they come from that kind of culture, a poor culture, a poverty level.
Okay. Thank you. I see Kathlyn vigorously shaking her head. So we're going to go to Kathlyn first on this one.
Well, thanks, Dan. I am very interested in this topic because I work particularly with a number of beneficiaries, healthcare beneficiaries that come from the low-income sector of our community. And one of the things that we try to stress with this population is that healthcare and good, healthy lifestyles is not expensive. That education regarding proper nutrition, education regarding a sedentary lifestyle and the need to exercise appropriately, education regarding lack of use of substances, alcohol, tobacco, as we've talked about earlier. That kind of education is actually, and health promotion, is actually very inexpensive. And then from the patient or the employee's perspective, very inexpensive in terms of engaging in.
And it's not only inexpensive, but you can address many people all at the same time, and you can get large populations involved.
Absolutely. In fact, one of the things that I like to look at is that if the employer gets involved with their employee, they've just reached probably 5 to 10 additional people in their community, because their employee will go out and share that information with their friends and their family, which will help to improve the lifestyle of the entire community.
Now we shift over for a brief follow-up to a gentleman who manages the health and welfare of an international firm.
Right.
What's happening in your international operations?
Well, there are clearly differences, as the caller pointed out, between socioeconomic levels of employees, even in my company, in all companies for that matter. So, and what's becoming well known in the United States is that socioeconomic status, or what we call SES, cuts across all health outcomes. It's probably the most fundamental issue in regard to whether or not people can achieve health. I again, not to sound like a broken record, but I agree with Kathlyn that the addiction, and I will start out by saying that I am very respectful of the miracles of Western medical technology. But in this particular country, we have become addicted to technology, and we seek technological solutions to every health problem. This is a very expensive proposition for other countries, and it's a very controversial matter that we're talking about now as to whether or not other poor countries will follow the lead of the U.S. and other developed nations in regard to its love of technology. I do not believe, as Kathlyn said, that the excesses of technology are the answer here. As a preventive medicine specialist, I very much believe in the notion that we've medicalized all sorts of social problems in this country, and we really have to look at the impact of social issues on health and the impact of fundamental issues like poverty and the economy on health, emphasize prevention, individual responsibility, and corporate responsibility for health.
That global model you just discussed really is starting to differentiate itself in medicine as well, where you don't just treat little pieces of things. It's now the whole, the whole body, the holism approach. Let's move to a question from the Universidad Ricardo Palma in Lima, Peru. Thank you for joining us.
I'm Professor Quineche from the University Ricardo Palma in Peru, and I have this question for you. About people who work and live in an environment where there are a lot of drugs. What strategies should the employer to try and help resolve this problem?
Thank you, Professor.
Muchas gracias.
You're welcome, and thank you for your question. The issue of the society being the place where the problem rests, and we'll come back to Kathlyn on this one because she's very involved in the San Diego community in the health issues. Your thoughts on that?
Well, as I was doing my research for this program and identified the drug abuse problems in many of the countries that we're having this discussion, this dialogue with today, I realized that the problem is much worse in your countries than perhaps even in the United States, where we think this problem is overwhelming. We think the problem is unbearable in San Diego. The information that I shared with you earlier identified that drugs are being used not only in the workplace, but in schools, and they're being used at younger and younger age levels. I believe once again that we have to, as good corporate citizens, ensure that our employees are consistently provided with education about the impact of these drugs on not only their home life, but their work life. I identified early a zero-tolerance policy that I think as employers we should put in place. That doesn't mean that we should not be compassionate. Drug abuse and the addiction associated with drug abuse is something that we ought to work with our employees to cure. It isn't something that we should say, now let us be punitive because you have developed an addiction. But one, I think we need to identify, we need to look for signs of drug abuse, and finally, we need to then find cures and treatment for drug abuse in the workplace.
We fight this battle in the U.S. constantly, and your insights are valued. Thank you very much, Kathlyn. We're going now to the Centro Costarricense in San Jose, Costa Rica.
Good morning.
Good morning.
How can we modify the behavior within an organization if many times the leaders drink in the office or take drugs themselves and they're not at all interested in any health programs in their companies, and they should be the ones setting the pace and the example?
Yes, yes.
It's sophisticated for them to do so. It's a sign of power.
I think that's a wonderful question. We're seeing some changes in the U.S. on that, where leaders are becoming example setters. But Dr. Lippin, I'd like you to handle this question.
Very important question. It really is, in terms of the role modeling that the leaders must portray. We have a leadership crisis in this country. Sounds like you have some leadership problems in your country as well. And it's absolutely incumbent upon leaders to set the example from a behavioral perspective and from an attitudinal perspective. There really need to be role models, and there's no excuse for leaders engaging in these destructive behaviors, which frankly are not only destructive to themselves and their families, but ultimately they're destructive to the corporations. Because if they're behaving that way from a health perspective, imagine how poor the quality of their business decisions might be. So I very much appreciate that question. And I would like to work with you in trying to define what constitutes good leaders. And certainly abusing drugs and alcohol is not one of those characteristics.
Kathlyn, have you seen a change in how leaders approach this role modeling?
Absolutely. And I agree with the caller. I think that for some time you were looked upon as powerful if you pulled out a bottle at the end of the day and greeted your guests with a cocktail, etc. I think we've got to move away, and we're beginning to move away. I think the leadership crisis is one that every one of us as employers have to stand up and say we're not going to engage in that kind of behavior. We're not going to do business with organizations that engage in that kind of behavior. And I think that, again, as leaders, not only do we have to shy away from these kinds of abuses, but then we have to show and set an example towards healthy lifestyles. Instead of an extravagant lunch with a cocktail, that we would exercise during our lunch. Again, tying back to an earlier telephone call, it can be very inexpensive. You don't have to join a gym. You can, during your lunch hour, go for a walk for a mile, etc. So I think it's not only disengaging in negative behaviors, but serving as an example to engage in positive behaviors.